Medical Coding Fundamentals, Chapter 12, Surgery. The surgery section is structured by, it's organized by body systems, and then by the body site, followed by procedural groups. Procedural groupings. Incision and drainage. These are procedures that puncture the skin or makes an incision, but does not close the skin at the end of the procedure, allowing for drainage. Excisions, full thickness removal of a lesion and surrounding tissue. When choosing the correct code, it will depend on the size, location, and if the code was for a benign or malignant lesion, code each lesion that is removed separately. We also have repair, revision, and reconstruction. Manipulation or reduction. This includes manipulation, which is manually applying external forces to align bones or joints to their normal anatomical positions. With fixation and fusion, we also have endoscopic and laparoscopic procedures. There's many different definitions you will need to be aware of when coding from the surgical section. A surgical package is a combination of services included in a single procedure code for some surgical procedures in CPT. Separate procedures. These are descriptors used in the surgery section of CPT for a procedure that's usually part of a surgical package but may also be performed separately or for a different purpose, in which case it may be reported separately. Global period. This refers to the number of days surrounding a surgical procedure during which all services relating to the procedure, preoperative, during the surgery, and postoperative, are considered part of the surgical package and are not additionally reimbursed. Radiological supervision and interpretation. This is when a physician may supervise and interpret radiological imaging, such as X-rays, during the course of performing surgery. Module 12.1, Key Concepts of the Integumentary System. We have superficial procedures, and these include incision and drainage, debridement, biopsies, skin tag removals, skin lesions, shavings, and excision of benign and malignant lesions. With wound repairs, we need to know the type of closure necessary, whether it's simple, intermediate, or complex, the anatomical location of the wounds, and the total length of wound for each closure type and anatomical group. Module 12.2, this includes the musculoskeletal system treatments. Your treatment options include closed treatment. This is a treatment for a fracture during which the fracture site is not surgically opened. Open treatment is treatment for a fracture during which the fracture is surgically exposed as part of the treatment. Internal fixation, a fracture treatment using devices such as plates and screws to maintain the bone alignment. Percutaneous skeletal fixation. This is treatment for a fracture during which the fracture is not surgically exposed, but pins or other devices are placed through the skin to hold the ends of the fracture in place. Traction includes the application of force to a limb through pins or wires attached to the bone, or through strappings applied directly to the skin to align bones to their original length and or position. External fixation. This is a fracture treatment using casts, splints, traction, and or external fixations to maintain the bone alignment. And manipulation. This is manually applying external forces to align bones or joints to their normal anatomical positions. When coding in the musculoskeletal system, you also need to know types of fractures. Closed fractures, this means that the overlying skin has not been compromised and the fracture is not exposed to external environments. Open or compound is when the skin is open and the fracture is exposed to the external environment. And comminuted is the bone is broken into more than two pieces. Module 12.3, Respiratory System. These are procedures on the nose, sinuses, larynx, trachea, bronchi, lungs, and pleura. We have the cardiovascular system, which is procedures on the heart and the pericardium, the cardiac valves, arteries, and veins. And the hemic and lymphatic system involves spleen, lymphatic nodes, bone marrow, and stem cells. The digestive system begins with the lips and continues through the anus. This will include such procedures as laparoscopy, which is the examination of the contents of the abdomen using a laparoscope or endoscope. Colonoscopy, examination of the inside of the colon by endoscopy. And proctectomy is a surgical resection of the rectum. Module 12.5, this deals with the urinary system. The urinary system procedures are organized by anatomical structures. The male genitalia procedures include procedures on both external and internal structures. And the female genitalia procedures are also internal and external structures. Module 12.6 deals with the endocrine system and it includes procedures on the thyroid, parathyroid, thymus, adrenals, and the carotid body. It also deals with nervous system divisions. These are done by anatomical structures. Ocular system procedures include the removal of the entire eye, the anterior segment surgery, posterior segment surgery, procedures on the ocular adnexia and conjunctiva. Auditory system includes external ear, middle ear, and inner ear. Homework for this chapter. Read Chapter 12, Modules 1 through 6. And since this is so much reading this week, I only need you to do checking your understanding for each module.